Hello everyone, my name is Manuel and this is Miss Mary Beth from Right at Home, and here's another edition of Bean Bag Banter. Hello Miss Mary Beth, how are you?
Hi, thank you for having me on.
Oh hey, it's our honor to have experts as our guests in our Bean Bag Banter program here. So what is Right at Home? What is home care? Well, if you could go ahead and explain
Sure.
what that is.
Sure, so I'm going to start off just by giving a little bit of a history of Right at Home, where we started. Originally, Right at Home was founded out of Omaha, Nebraska, if you could imagine. Our founder, Alan Hager, came up with the concept in 1995. So my mom and dad were exploring different industries that they wanted to get into. My dad had always been an entrepreneur. My mom had experience caring for her mom and dad before they passed. They had some experience bringing in private duty home care for their loved ones, and they just thought, you know what, we think we can do a better job. There's going to be a lot of older adults needing services in home.
Yes.
So burst the idea to connect with Right at Home. So when they got into the franchise system, they were office number 40. So we cover Frederick, Carroll, and Howard counties. I work out of the local Ellicott City office.
Okay.
Now, Right at Home has expanded to over 500 active franchises across the U.S., and they're in 8 countries. So home-based care is huge, and we're happy to be a part of it.
Sounds good. So 40 out of 500. I didn't know that it's international as well.
International. So they have franchise systems in Canada, as well as the UK, Ireland, Australia, just to name a few. I've had the opportunity to meet some of the international owners, and it's pretty cool to see what people are doing with home care in other countries, how it's similar, how it's different.
Sounds
it's very cool.
That's super. That's great. Thank you. So given that, I mean, we always hear what home care is, and like what you mentioned, that your mom experienced trying to take care of her own parents.
She did.
And as everybody here could go ahead and imagine that everybody has to take care of somebody in one in their point in time, and it doesn't have to be parents as well, correct?
Correct, right.
So, all right. So given that, when you say home care, can you go ahead and elaborate that a little bit more? And I know we have these fancy visual stuff that we have here, but if you could go ahead and share it to our awesome viewers here.
Sure. So just to kind of expand on what in-home care means, you might hear the term private duty or one-on-one care, non-skilled care, non-medical care. They're all pretty much meaning the same thing. So our services are provided at the home. The home could mean different things for different people.
That's right.
So it could be their residential home, an older adult apartment complex, an independent living or an assisted living community. And essentially the care is being provided anywhere from 1 to 24 hours a day, 7 days a week. The client lets us know which day and time works best for them, and then we have the caregiver helping with things like meal preparation, reminding someone to take their medication and documenting that we saw them take their medication. Light housekeeping, so dishes, laundry, sweeping. I never like to say that we are a really housekeeping company. I mean, our caregivers aren't going to be scrubbing windows, not going to be down on their hands and knees, but laundry and dishes are one of the two
activities,
big needs.
Daily activities.
An activity of daily living,
yes,
where it can be strenuous on the body. You know, if you can imagine, you're bending down, you're standing back up. So in an effort to prevent falls and not have our clients be up and down the steps to do laundry. It's just a simple task that our caregivers can help that person get through their day-to-day routine.
Sounds good.
Transportation is another biggie, so we provide transportation locally for someone for their follow-up doctor's appointment, if they need to run errands, they want to go out to lunch or walk around the mall or go to one of the awesome 50+ centers that we have here in the county.
Absolutely.
Wherever they need to go.
So, and you mentioned earlier, so again, this is non-medical, correct?
Yes, non-medical. I don't like the term non-skilled or non-medical.
Yeah, I'm not going to say non-skilled.
No, that's okay.
Just non-medical.
Yeah.
So, okay.
That's a term that I hear. Sometimes the hospital will refer to us as non-skilled. And The big distinction is skilled care is covered under Medicare, and skilled care would involve the therapies and the adult, the wound care, the skilled nursing care at the home. So we work in tandem with skilled companies. We are not providing occupational, physical, or speech therapy. We're providing the around-the-clock daily care. We're kind of filling in the gaps. So someone might have a physical therapist coming to their home every Tuesday and Thursday, but what happens when that person needs help on Monday, Wednesday, and Friday?
Exactly.
So in addition to the housekeeping and transportation, we also help our clients in the home with bathing and personal hygiene assistance, helping that client get in and out of bed safely, get into the shower. We have caregivers who are very experienced with Hoyer transfers. So maybe that person is bedbound and they're relying on us to get them up in the morning or help them get safely into bed at night. It's really unique and very individualized care. Not one client is the same. So that's the approach that we go into the homes with, is tell me what you're looking for, what are your needs, and how can we work around that and keep your loved ones safe.
And how we can meet those needs accordingly. Yeah, and I'm glad that you've identified in terms of the skilled, non-skilled, because for me, as a layperson that's not an expert in your field, is that for me, everybody has their own respective skills. So I'm not going to go ahead and identify that. But of course, if it's Medicare identifying a specific lingo, if you may, then okay, I understand now. So, and again, the reason why we're doing these videos is that to be able to educate the public a little bit more, just like me. Every time I go ahead and do this, I go ahead and learn something new.
Absolutely.
Even if, I mean, we've known each other for at least 4 or 5 years now.
Going on 5 years.
Yeah, so again, and maybe a different plug here, we're members of Coalition of Geriatric Services, and that's where we met each other. And we've been working together with all of these mini health and wellness events at senior apartment living and stuff like that. And yet here I am, I'm still learning some new things.
Me too. I mean, hey, I don't know everything. Even when you think you do, something new comes up each and every day. So it's really nice to be connected with other providers because we're constantly learning and sharing and growing. The world is ever changing, and the needs of people are always changing. So.
And with everything that she said, that's why we are doing this Bean Bag Banter, because as much as we want to be able to be the one-stop shop of everything, but no, we're fully aware we're not. That's why we're doing these programs, in order to go ahead and help everybody out on what are the services out there. Because again, as simple as mobility, I mean, the fact that we were able to come to their lovely office here, their clinic here in Ellicott City, we may take that for granted, but there are some people who will be needing such help, and that's where you guys go ahead and come in.
Yeah.
So.
Yep. Exactly.
And now you mentioned about Medicare, so and you mentioned about being non-skilled. I'll put that in air quotes right there. So, are your services covered by insurance then?
Unfortunately, they're not. Medicare does not cover what we do. Some long-term care insurance policies will cover home care, so it's important that if your loved one has a policy, to call and see if you can tap into some of those benefits that they've been paying for so long. It isn't, so typically it's an out-of-pocket expense. The nice thing about Right at Home is that we do anything from 1 to 24 hours, 7 days a week. So if someone may not be able to afford an 8 or a 12-hour shift, we work with them and we do as much as we can in those shorter shifts to make sure they're safe, and we can leave knowing that we were there maybe for a short amount of time, but when we come back the next day for an hour or two, they'll be in good shape.
So whatever the priorities are, if you may, of what they actually need. So there, and sometimes too, okay, so if it's not covered by insurance, it can go both ways. At least you're not paying for all the premiums that you've been paying, and then you might end up having a deductible and stuff anyway, so might as well go ahead and, so don't view it that, okay, this is a cost, but try to look at the value that you're going to go ahead and get.
Right, and I just to elaborate, you can't really put a price on, dignity and the value of staying safe at home. So, if you're looking into alternatives to be able to age in place, home care, non-skilled home care is is a big part of it. And we all work together to maximize your benefit. So where we might not be able to provide, a therapist to come in the home, then we can give you a resource and help refer you to a local agency that does do that, or refer you to a medical equipment company that can do home modifications. We really do try to get creative and come up with a solution to the problem.
Okay. And that's what one phrase that you identified earlier is the aging in place. And then I know you've identified the cost. This is going to be out-of-pocket costs, correct? But the thing here is, and you mentioned earlier, the assisted living facilities, for example. So you guys can go ahead and do the math. I mean, obviously, in every stage, all of those are important. But however we can go ahead and stay and age in place, I think you would appreciate that more than being totally dependent out of an ALF. But of course, the ALF has its own space for those that's absolutely needing it. But however we can go ahead and delay that and continue, like what you said, to live in dignity with what we're doing by providing this support. Again, you can't, like what you said, you can't put the price.
You can't, and there are times when our clients, it's no longer appropriate for them to stay at home. We recognize that, and for the safety of the client, we might have the opportunity to say, Mr. or Mrs. Smith is really no longer appropriate at home, and without 24-hour care or without a live-in, we really think they'd be much safer. And we work with many assisted living communities here who specialize in memory care, or whatever.
Parkinson's or whatever
the need may be. So we can connect them to the appropriate person. And then the family, there are options. One size does not fit all. It's not cookie cutter. So if home care isn't appropriate, that's fine. We want to make sure that we're a resource within a resource, and that our clients and their decision makers, family members, whoever, always have a place to go for help.
Yes, and again, this is just one piece, if you may, of all the help that you can go ahead and have out there. And just like what you mentioned earlier, when you go ahead and call them, you identify what your needs are, and you'll be able to identify what you can go ahead and help out with, and other things that you have to go ahead and refer out. All right, so who's providing the care there? So as you mentioned, okay, the non-skilled component, and I know you've identified some of the services that you do. So when you say, who's providing the
Who's coming out to
who's coming to the homes, yes.
So we have a lovely bunch of certified nursing assistants and geriatric nursing assistants, certified through the state of Maryland, who are coming out to perform the home care services. They're overseen by our delegating nurse, Stephanie Burns. So essentially, she's helping with the care plan during the initial assessment when we're going to meet with the clients in the home. We want to get an idea of, not just their demographic information, not just their date of birth, but what types of care they might need, if they have any diagnosis, if they're having any surgeries. Once Stephanie gets that information during her clinical assessment, she types it up nicely in a care plan, and then it's up to her to make sure that our caregivers understand what the needs are, and that she follows up with them throughout the course of us being in the home, that to make sure they're still encouraged and supported, and the client is receiving the best care possible. So we all kind of play a part in helping our CNAs and GNAs. That's an acronym you're going to hear a lot in our world. Our certified nursing assistants are, they feel like they're ready to go in the home. We're not just pushing them out there. We do a lot of homework prior to sending them to a shift. There's a lot of details. Some of our cases are very intricate and unique, and then other cases are pretty simple, but no matter what, we come up with as much information as possible.
Wonderful. So you mentioned, so everybody that comes to the homes are certified?
They're certified, yep.
Okay, all right.
And even if not all of our cases require hands-on care or personal care. So technically through the state of Maryland, you don't have to be a certified nursing assistant for more companion level.
Okay.
We, more often than not, our cases do require that personal hands-on care. But if not, at the very least, Right at Home does require anyone who is employed with us has to have verifiable experience. We do check references, and we do our own training. We have a training facility out of our main hub in Frederick, where we have a hospital bed, a Hoyer lift, a bedside commode. We actually have 2 geriatric dolls, so the caregivers can be observed, putting that person safely in a Hoyer and operating the Hoyer lift, transferring someone out of bed. Everyone goes through that training, regardless if they've been in this industry for 50 years or they are brand new CNA of 6 months. Our nurses are there watching them and documenting and signing off that, yes, this person's comfortable. And if they have a lot of experience with hospice, maybe they don't have a lot of experience with Alzheimer's or vice versa, then we can have that caregiver shadow with some more experienced caregivers. Our nurse oftentimes works one-on-one with that caregiver to kind of help them develop their skill. And that was a long-winded answer.
No, that's good. Because I just want to go back to what we were talking about earlier regarding the skilled versus non-skilled, and yet here you're doing all of these trainings, and
it's very skilled.
Yeah,
it's a term. We'll forget about that.
Yes,
we'll just call it private duty, one-on-one care. Forget the non-skilled, because what we're doing is very skilled work.
And I think for the viewers out there who may be needing such services is that that you will be confident and comfortable that it's just not anybody that will be coming into your home and helping you out. They are CNAs, they are GNAs, and in addition to all the training that Elise right at home will go ahead and provide. So there. All right, cool. So is there anything else that you want to go ahead and share that that the public may not necessarily be knowledgeable of, or like a myth that's floating out there? And see if you want to bust that right now, or clarify if you may.
I'm looking over here at my panel expert, aka my sister. She works here in the office with us. She's whispering things into.
Apparently, we cannot afford her.
Yeah.
So, but
she's Trisha's too expensive, so you guys get me for free.
So again, thank you, Mary Beth, for being our guest here.
Yeah,
but go
thank
ahead.
you.
Yes.
I guess I would just like to kind of leave you with. Not necessarily a myth, but just some advice. There might come a time where you're looking into care, whether it's for yourself, for your aunt, your uncle, your neighbor, whoever. It's really important to ask questions. Who is coming into the home? Are they credible? So not only just trained and skilled, but do they have a background? Do you do background testing? Do you do drug testing? What makes your company different? Do you have any kind of hourly minimums? Are there any hidden fees? Is there a contract? We do not have a contract. We have a service agreement, so clients can use us as little as 1 hour and then never use us again. But these are important questions to ask. That way you're not in a situation where you've signed on to services, you're not happy with them, and then you're kind of stuck.
Stuck with that.
Yeah.
Okay. Yeah, and I'm glad that you brought that up as well, because again, these are daily things that you guys get to have conversations with, or how things work. So I appreciate that.
Yeah,
Thank you.
please don't hesitate to give us a call if you have questions and you just want to know more about the industry. I'm happy to help kind of give you a better understanding of the day in the life and how this all works behind the scenes.
On that note, what's the best way to go ahead and reach out to you or your wonderful office here?
Sure. So our Ellicott City office number is 410-461-2055. That is a 24-hour line, so no matter who calls, if it's a weekend, if it's a holiday, you can get in touch with a right-at-home representative. You can also visit our website, www.rahmd.net. You can type in your zip code, and you can, if you're looking for a specific coverage area, it'll bring up, the local right-at-home office that services you.
Wonderful. All right, great. Thank you. So again, everyone, if you have any questions regarding this, feel free to go ahead and reach out to Right at Home, the Mary Beth and his wonderful team here and her wonderful family here. So again, however you need that help or assistance, go ahead and reach out. Thank you again for watching another edition of Bean Bag Banter, and we're looking forward to have future guests out there in order to provide more informational videos regarding all the things that they go ahead and do. And yeah, so if you have any other suggestions, feel free to reach out to us. Thank you.
Thank you for having me.
All right, appreciate it. Thank you.
We'll do this again.
Yes, we'll do it again.
See ya. Woo! Hey, how'd you stop that?
Still on.
Oh.
It's okay. But this one we can easily edit. That's why I had to pause a little bit so I can